Hi guys, welcome back to a new video. If you're new to my channel, you're very welcome. My name is Busola. I'm a final year medical student living in Nigeria. I make videos about medical school and lifestyle. If you've not subscribed to my channel, please hit that subscribe button right now. Check out all my other videos. I'm sure you'll find them interesting. So like the title says, in today's video we are going to be discussing, or I am going to be giving you a few tips on how you can ace your bedside exam, long case exam, how you can ace it and just get the best out of it and put your best foot forward. Pretty much, I am a firm believer in doing your part and making sure that you know for a fact that you've done your part. So yeah, that's what this video is going to be about. I'm going to be giving you all the tips that has helped me. These tips are still helping me. I think I have one last bedside exam to go in medical school. They've been helping me so far and I just want to share my tips with you. Okay, if that is a video that you think that you'll be interested in, then please keep on watching. By now you guys must already know that I am the queen of disclaimers. Before I give a lot of these advice videos, I like to put disclaimers in the beginning of it, just so that you know where I'm coming from and you are not here just taking whatever it is I'm saying hook, line, sinker. I am kind of like Naira Marley in that video where it was like, I'm just saying, I'm just saying.
I was just thinking, you just want me, it's already me, I'm just thinking, so just
like, I'm just saying, this is just my opinion, okay? Like you people already know, I'm still a student, okay? I'm not a consultant, I'm not a lecturer. It's not like I've gotten to one point where I know it all and now nothing can ever go wrong. I don't know it all. I am still learning. If you are a medical student, you already know that every single one of us gets ruptured at one point or the other. Nobody actually really knows it all. I just wanted to put that disclaimer out here. Every time I have bedside exams, my friends will testify to this, I get so anxious. My anxiety is through the roof. Like, I get thirsty, my body starts shaking. I cannot calm down right before we start the exams. Like right before they call us in and say, oh okay, this is your patient, I cannot just be calm. So that has to show you something, that it's not like I have one, you know, mad ass confidence somewhere and it's just like, yeah, no matter how this exam goes, no matter who my examiner is, no matter what my patient has, no matter how cooperative he or she is, then you know I'm still going to ace this exam regardless. I am definitely not like that. However, I have some tips that I feel like has been working for me over the years. The things I'm going to say are not new things. You know, there are things that if you hear, you are going to realize that, okay, I knew that. But a lot of the time we don't pay attention to these things until somebody points it out and say, like, these are the things that I'm doing and that is why it has helped me. Like, these are the things that I am paying attention to and that is why it has helped me. You probably won't really pay a lot of attention to it. My bedside exams are usually my favorite exams. Not favorite like I like it, favorite like I score highest in them. Like compared to my theory, my OBJ, my picture test, whatever, my bedside exams are the exams where I score the highest. It's not like I know all of the stuff in the world. The things I do are very, very small things here and there that just accumulate to become big things that actually matter. Yeah, before we continue, let me just explain what bedside or long case exams are for people who may not be in clinicals yet, or even if you're a non-medical student, just so that you know. So bedside or long case exams are the exams that we do in medical school. In clinicals, so clinical starts from 400 level, 4th year, and those are the exams that we do in medical school, where you get your patients, like you actually get a real life patient. So they can either give you a patient on the ward, a patient that has been admitted that the hospital is currently managing, or they can give you an outpatient, that's a patient in the clinic, a patient that came from home because they have a complaint and they want to see a doctor. So you can either get any of those patients. In my opinion, getting a patient from clinic or wards don't really matter, to be honest. Like I've heard people say that patients on the ward are better because you know a specific diagnosis and you know how to treat them and whatnot, whereas a patient at the clinic, you have to actually decipher what the diagnosis is right at the spot. Quite frankly, I don't think that is the point of exams. Yes, diagnosis is a part of it that is important, but I feel like a lot of people focus too much on the diagnosis of a patient in bedside exam. That's just a part of it. Your system, you can actually get a wrong diagnosis, okay, especially for patients in the clinic. You can get a wrong diagnosis that makes sense from the patient's presenting complaints, whereas you can get a correct diagnosis, but from your clerking, from the history of the patient, from the way you collect the patient, from the history of the patient, it's not making sense. The most important thing is to be able to convince your examiner that with the symptoms that the patient, with the way you've cleared the patient, with the examination findings that you have done, like when you are doing physical examinations, with everything that you've done, everything makes sense in the diagnosis you are giving. The essence, in my opinion, or I may be wrong, but in my opinion, the essence of bedside exams are to test if you can properly clear a patient, properly get the appropriate history from a patient, collect them appropriately, examine them well, and come to a reasonable diagnosis from the things that you've done. Okay, everything, the three things need to merge, they need to make sense. So it's not about knowing the diagnosis of your patients. You can know the diagnosis of your patients and your exam will still go completely left. So I try not to focus on diagnosis. Okay, I think that's the number one thing that I'm going to say. Try not to focus on diagnosis. Okay, so if tomorrow is your bedside exam and you're watching this video today, I'm sorry, I'm not a magic maker. Okay, I'm not a magician. This is very, very, very important. You have to know how to click. You have to know how to click. You cannot know how to click and be going for bedside exams and expect some magic to happen. You have to know how to click. And how do you know how to click? This thing is actually very simple, but you need dedication. The only way for you to know how to click is to click. I don't know how else to say it, but the only way for you to know how to click is to actually do it, is to actually click. While you are in that posting, while you are doing your rotations, make sure you click as much as you can and make sure you present. If you are clicking and you are not presenting, you are doing yourself a world of harm, because you are clicking, you are keeping the clicking, you are not hustling to present to somebody, present to your consultants, present to your senior registrars, so that you know what you are doing wrong, what you are doing right, so that they would correct you. Like, I do not, if people who know me know that I don't shy away from clicking and presenting. Like, I think that is the number one thing that has helped me. I click a lot. Like, I make sure that I click. Like, I put a lot of effort into clicking and trying to present as much as I can. And then while I am presenting and they are giving me those corrections, I am making a mental note. I'm making physical notes as well, so that I, like, the next time I'm clicking, I make sure that, okay, this thing that they've corrected me for, I'm not making that same mistake again. It is so important. I don't know how else to explain it. Another reason why you should click and present, especially to your consultants, the easiest time for you to present to a consultant is during clinic. So when you're at clinic doing your postings, even if they don't actually actively tell you guys to go and click and present, try and remind them, ask them, like, please, are there any new patients that we can click, that we can present? I don't care if you insult me during the posting. That's not my business. If I knew it, I would not be here. I don't know it, that's why I'm here. Even if they act surprised that there are some things you don't know, that's not your business. Your business is not making that mistake during exams. Your business is that during exams you have to have known. Not knowing during posting doesn't matter. If they rupture you during posting, it doesn't matter. Just make sure that you are clicking, that you are presenting. It's so important, so important. That's my number one tip. If you're going to take anything else out of this video, take that out of this video. Your consultants are most likely going to be the ones to examine you, and some consultants have some peculiarities that if you presented to them during postings, they will tell you. Like, if you are presenting and you say something, they will tell you, no, I don't want that. Some consultants actually have their different styles. There are some things that they want you to say. There are some things, especially for some cases, there are some things that they want you to say, ways that they want you to present your case, and it is only by presenting to them and having them correct you that you will know the style, their style. Some of them have their peculiarities that you would not know anything about if you actually do not interact with them during your postings. Very important, very important. In medical school, there are some cases in every unit. There are some cases that are more common than others. And there's a saying in medical school that common things occur commonly. And that is very, very true. While you are about to have your exams or doing postings, you already know the cases that are very rampant. For example, in general surgery, you'll probably see anterior neck swelling, breast cancer, obstructive jaundice, stuff like that. Those are the common cases. Like the chances that you will get that case, one of those cases in the exam, very high, like 90%. But there are some times that you can be unfortunate, and maybe not unfortunate, to be honest. Like it can go either way depending on your mindset, that you would actually get an uncommon case that you did not prepare for. That try as much as possible, prepare for the common cases first. The chances that you will get the common cases very high. But at the same time, do not streamline your mind to it is either one of these cases or it is nothing. Because if they give you the case that is not common, then it's nothing, or you will get nothing as a score. You will get 0 because you did not prepare. And this has happened to me before. I had prepared, this was in 5th year, I had prepared for some specific cases, and as I was going to the exam, I was just praying, God, I want either this case or this case or this case or this case. Like I was praying so bad. I was so anxious. And then I get my patients. I'm like, please, why are you here today? Like, because that was in obs and gynae. In obs and gynae, from their presenting complaints, you already know what they have most of the time. What are your complaints? And she gave me one complaint. Like immediately she said that thing, immediately she said it, I already knew that I was done for. Because that was definitely not one of the cases that I prepared for. It wasn't one of the common cases that you would see. In fact, throughout my whole time, I'm not joking, throughout my whole time in that posting, I only clicked one patient who had that case. I did not expect that I was going to have that case. Like immediately she said that, I got very discouraged, like, God, like this exam is going to go so bad. But one thing that worked for me is that immediately I was just like, okay, try to bring yourself together. You know this thing. Try as much as possible to do your best. And you guys, till date, I promise you, till date, that is still my best bedside exam ever. I got the highest mark possible, like the highest mark possible for that bedside exam. I got it. So that is why I'm saying, it can be a fortunate or an unfortunate thing if you get an uncommon case. The reason why it can be fortunate is because for a case that is common, there is so much you can do to impress the examiner. These are things that they expect you to know. There's little you can do, there's little you can say to impress the examiner in common cases, because they already expect you to know it. They already expect you to know the ins and the outs of it, and they will still not give you the highest mark possible. They will just give you a good score. You won't fail, but you would not get the highest score. Like you have to go the extra mile to get like a very, very high score with a common case. Whereas with an uncommon case, right, once they already even know that this case is not a case that is common, the things that you say, even if you just give regular answers that show that you have a good knowledge of the case, they are more impressed by that. You don't have to go above and beyond to impress a lecturer, to impress an examiner with an uncommon case. Don't put all your eggs in one basket and think that it is either those common cases or nothing. You may be surprised. Definitely, first of all, prepare for the common cases first and make sure that you know that one, because there's a flip side to it as well. If you get a common case and you are now saying rubbish or you are not doing well enough, then that exam will go very, very bad. Don't zero your mind to just common ones. You can be the unlucky one that will get that uncommon case. And if you get that uncommon case, try and turn it around for yourself and make the best out of it. Okay? That while you are in the exam hall, while you are writing your exam and you are clerking your patients before your examiner comes, try to perfect your clerking. Like, let me explain this. The way bedside exams are supposed to go, you clerk the patient, then you give a summary of the presentation, that the clerking that you've done, then you examine and you put down your findings, then you come up with a diagnosis, then you write your plan down, your plan for the patient. In the management of that patient, you write your plan down. So that's how it goes. Now the examiner can come and just say, oh yeah, examine these patients, or the examiner can come and say, what's your diagnosis? Like, the exam can start from any point, literally. But most of the time, more commonly, the way the exam goes is that they will ask you to present your patients first. So you start from clerking and you present your clerking before the exam starts going, you know, in other different directions. So more commonly, that's what you will see. And that is why I would advise, which is one thing I always do, I perfect my clerking. Like, when I'm writing my clerking, I leave no stones unturned. From the biodata of the patient, from I'm presenting Mr. blah blah blah, a 32-year-old carpenter who resides at so so and so. From that beginning, my clerking, I try to make sure that I have no errors, no loopholes, nothing that you can, you know, fault me on, because I know that that is the first contact, and the first impression that you make to your examiner really matters. It determines how the exam is going to go. It determines the questions that they are going to ask you subsequently. If you have made blunders in your clerking, in your presentation, then the examiner is already thinking, okay, this person doesn't really know much, and they start asking you some weird questions. Whereas if you have clerked your patient in a way that demonstrates that you know what you are saying, then they just start asking you. The exam more commonly will go in the right path. It will now go like, okay, so how you manage this patient, okay, examine this patient, you know. Whereas from the beginning, if you're already saying weird things, like somebody came with dark colored urine as part of their presentation, and you did not collect the other urinary symptoms, then they're already thinking you don't really know what you are doing. And then that way they can now start asking you, your patient may have obstructive jaundice, they can start asking you something related to CKD. Like, they can, the exam can just go in that direction where they think that you don't have the knowledge, you know. Like, so try as much as possible to perfect your clerking. Don't say any nonsense. Make sure that the things that are supposed to be there are there. There is like an art to clerking. If your clerking is good and your examiner comes and the first thing he asks you to do is to present your clerking, and you do that well, chances are that that exam will go well. And that is like my biggest strength, to be honest. That thing is my biggest strength. It's not like I know all the stuff in the world, but I will make sure that from that clerking, you think I know it all. That's the problem. Like, I will make sure that from that clerking, if you should mistakenly ask me, present your case, from that clerking, you already think that I know everything. Whereas there are some things that you actually still ask me that I'll be looking at you like, Momo, like, I can't really remember that. This happened to me in an exam where the examiner came and is like, okay, present your case, present your patient. And even I knew that I clerked that patient well. I presented from beginning to the end, and by the time I was done and I looked at this man, the man was smiling. No jokes, like, he was smiling. You could tell that he was so impressed. That experience actually was what made me know that the impression that you give, that first contact, the first thing that he asks you, the impression that you give from your clerking matters a lot. Sing like you are in the choir. Sing your answers. Do not stop until they ask you to stop. Don't let them be prying questions out of you. Don't let them be making efforts to make you answer the questions. Be very, very forthcoming with answers. It actually irritates examiners. I've seen it actually, when they have to keep asking you, like, they ask you, what investigations will you do for this patient? You said, okay, I will do full blood counts. They have to say before you now say the next one. They will now say No, if they ask you a question, and the thing is that with these exams, there are time allocations for them. You want to, as much as possible, spend more time answering less questions. And the only way you can do that is, don't give short answers. Obviously, you don't be saying irrelevant things. But for example, if they say that, let me use this again, how you investigate this patient, you start talking, you start singing like you're in the choir. You won't just go and start like, oh, okay, I would do full blood count, I would do liver function test, I would do chest x-ray, I would do no. First of all, you are not spending as much time, and secondly, you are not demonstrating knowledge. If they ask you that kind of question, first, you even want to group it: major investigations and ancillary investigations. If it is intestinal obstruction, you want to tell them, first of all, the most important investigation. They already know that you know what you are saying. The most important investigation, you do plain abdominal x-ray, erect and supine. You know, you're not just saying, oh, I will do plain abdominal x-ray, and then you will now wait for them to say, okay, what are you going to see on plain abdominal x-ray, and how many types of abdominal x-ray will you do? No, I will do plain abdominal x-ray, erect and supine. On erect, I will see so and so. On supine, I will see so and so. In a patient that cannot stand, I will do lateral decubitus. Those are the things that you are saying. All of us know these things during postings, but when it now comes to exam, you are not expecting the lecturer to be dragging questions out of you. No, if they ask you one question, just keep going. Don't say stupid things. Again, like I said, don't say stupid things, but just keep going. If they ask you a question that you know, try and demonstrate as much knowledge as you can. Try and spend as much time demonstrating as much knowledge as you can. It is very important. It matters in the way that you impress the lecturers, impress the examiners. It matters in the marks that they are going to give you. It matters in the direction your exam is going to go. Don't say things that you are not sure of. Like, do not give values. Do not say things that you are not sure of. That can make your exam go very bad. It's better for you to keep quiet, to omit some things, than to say something that is completely wrong. Your exam will go very, very wrong in that way, to be very honest. Like, for example, if they ask you, what drugs are you going to give, say the drug. If you are not sure of the dosage, don't say the wrong dosage. That is very, very dangerous, actually, because they believe that when you become a doctor, if you are not sure of a dosage, don't assume that you know and give a patient the wrong thing. It's better for you to confirm, to cross-check, than for you to assume that you know something that you actually don't know, that may kill the patient. So it is very dangerous for you to say things that you are not sure of. That exam can either end there, or it can just go left. So it's either they get very angry, like you've killed the patient, and once they start telling you that you've killed the patient, your hypothetical patient, you already know you will not really get a very good score. It's either it goes that way, or they now start questioning your knowledge, and instead of them to now be asking you normal questions about the investigation, the signs that you see in the patient, the way that you manage the patient, and all of that, the drugs that you give, the surgeries that you do, what kind of surgeries you do, all of that are more straightforward, they will now start asking you funny questions. Once they start asking you all those small questions, your exam is already going wrong. Your exam is not going the right way, because then you now start saying funny things, like, because a lot of those things you can actually model them up, and for them to be asking you all those small questions, it means that you have gotten it wrong. Like, for them to be asking you questions that are so basic, like they've now gone to the fundamentals, because they are really looking for a way to pass you, because you've said so much, you've said nonsense, and then they are just trying to see, like, do you know what you are talking about, or do you not? Your exam is not going right. So try as much as possible to avoid things that you are not sure of. You don't want to now come and start serving them your ignorance on a platter. Say, take, this is what I don't know, examine me on the things I don't know. No, you want to direct the path of your examination, emphasize your knowledge, and try to hide your ignorance. Last but not least thing that I'm going to say, and I've said it before, be confident. Okay, be confident. You've prepared for the exam, you've gone for the postings. I hope you have. You've prepared for the exams, you've gone for the postings, you've put in the work. Just be confident now, and do your best, and to be very honest, just leave the rest. Just make sure that you do your best in that time. Make sure that you give it 100%. Give it every single thing in you, because after that you can go and rest, you can go and sleep. Okay, you don't want to be regretting that you did not put in as much effort when you could have. Yeah, I wish you all the best. I wish myself all the best as well. That brings us to the end of this video. I hope that it helped somebody. If you enjoyed this video, please give it a thumbs up, share it to your medical school friends and family, subscribe if you've not subscribed, and last but not least, you already know, don't forget to be kind to yourself and be kind to others. I'll see you in my next one. Bye.